It's my true honor to get to introduce to you Darrell Steinberg, who's one of Sacramento's most accomplished public servants, serving the Sacramento community for over 20 years. He was elected to the City Council when he focused on making neighborhoods safe, creating good jobs, and providing quality after-school programs. He founded Sacramento Start to help kids in the most challenging school districts there. He later ran for state assembly and then was in the state senate and became the first Sacramentan to serve as president of the Senate. As a Senate leader, he got things done by building coalitions to deliver results, including guiding the states back to fiscal solvency during the economic downturn. He authored the Mental Health Services Act, the first of its kind in the nation that generated $2 billion a year for people in need. He is he's focusing on diversity and economy in the Sacramento area and has really been the best advocate for mental health that we've had in the California State Legislature ever. So it's very much my honor to introduce Darrell Steinberg.
Thank you, Jeannie. Thank you, Jeannie. Thank you very, very much for your nice introduction. And thank you for welcoming me back to my alma mater, UCLA. Go Bruins! I wish this Saturday we were in front of our television sets watching them in the Final Four, but it was close, but not quite to be. I come back to UCLA, and I can tell you I graduated from UCLA in 1981. I was a child prodigy, 7. And I don't recognize the campus anymore. I mean, it is just so fabulous to be here and see its growth and to be here at this Luskin Center, which is just, 5-star here. It's 5-star at my alma mater. And I'm grateful to the UCLA Behavioral Health Center, Dr. Tejas, thank you, and Peter Wybrow, thank you so much for inviting me and for having me. And to be here as well reminds me of the work that we were able to do together back in my last year in the legislature. I think it was my last year, in 2014, where California had finally gotten through the worst of the recession, and we had some one-time money, and we said, why not put together a north-south applied research program here? And Ken Wells, thank you. You were key to this, and I see Cam Carter here from UC Davis as well, where we said, let's take several $1 million and let's invest half of it at UC Davis and half of it at UCLA, and let's begin developing California, or advancing California, as the leading research and clinically based research center for mental health in the country and in the world. And I know over the course of the last couple of years that both at Davis and at UCLA, that you are doing exactly what it is I know I envisioned when we put that trailer bill in the 2014 budget. And today is another opportunity to sort of ask the question that we must always ask in this field or in any field. Where have we come? Where are we now? And where are we going? And so I've been privileged to serve in public life for 20 years, now in my 21st year. I decided to seek a big promotion from pro tem of the Senate, so I ran for mayor of Sacramento. And I was fortunate enough to win, and now I'm dealing with really the same sets of issues, but just at a much more microscopic level, right? It's not about passing bills or passing initiatives, it's about actually applying some of the tools we've developed over the years to see, for example, in a so-called mid-size, which is not really mid-size because it is growing, a city like Sacramento whether or not we can actually end homelessness, or at least make a big dent by focusing on the full-service partnership model, by focusing on assertive outreach and mental health and substance abuse services and case management and housing. That formula, that secret, too secret sometimes formula, that has actually led so many people to reclaim their lives and actually get so many people off the streets. And as I say many times, we know what works and what to do. We just need to develop the inventory and the capacity to be able to do more of what we know works. And I'm so pleased that in Los Angeles County that the voters passed, was it Measure H?
Right.
Measure H, combined with the housing measure passed by the city voters at the last election, combined with the state's No Place Like Home initiative, the $2 billion housing bond using Prop 63 to provide the capital for housing for people on the streets living with severe mental illness, we are beginning to develop and create and enlarge that inventory to be able to do more of what we know works. But let me back up for just a moment and speak about why research is so important, and why research, especially around reducing disparities, is so important. And some of it, in the science field, in the social science field, and the political field, sometimes it's important just to simplify, because these issues themselves are often so difficult and complicated. And so I often think about how far we have come around busting the sometimes unattainable, or at least thought to be unattainable, notion of stigma when it comes to mental health. Think about that we've made great progress, in part because of the work of Richard Van Horn, the work of all of you, the people that have been on the cutting edge of these sets of issues for many, many decades. But how far we still have to go. When you think about a person who suffers a heart attack and you call 911 and they're rushed to the hospital, there is never a question about whether there is an available hospital bed for the person who suffered the heart attack. And yet our emergency rooms are overflowing with so-called 5150 patients who suffer a medical crisis and are rushed to the emergency room, and the stereotype is too often true, linger in the waiting room or in the hallway for 24, 48, or 72 hours. We know that if you're a working person and you have to leave work for a month because you suffer from diabetes or health-related diabetes, that you come back to work and you probably aren't reluctant to at least talk to your coworkers about why you were out of work. But if you leave because of bipolar illness, schizophrenia, or depression, and you come back to work, more often than not, you're not going to talk about why you were out of work for 2 weeks or for 30 days for fear that you're going to be stigmatized and maybe denied that next opportunity for promotion. We all know these things. And we know that if you see somebody on the street corner with a gaping bloody wound in their leg or on their chest, that you're going to stop and render medical aid to that person who obviously is in the midst of some sort of a physical trauma. But we all walk by, including myself every day, the people on the streets who are talking to themselves and who are just as ill, but in a way that, for whatever reason, makes it harder for us to stop and attend to that person. And so research itself is not the only answer, but it is a big part of changing those realities that I just described. Because when the public and policymakers know that there's an actual cause and effect between early intervention and avoiding people suffering those first breaks and inevitable cycle of jail and homelessness and early death, when they know those interventions work and they see the stories and they see the data, they are much more likely to, one, believe that we can achieve different outcomes, and two, be willing to invest more in what we know works. Research and data gathering is itself, by definition, done in the right way, destigmatizing. And so I think about the Mental Health Services Act, and for some of you who have heard my talk on this, please excuse the repetition, but I really think it's that serious here. I think you can say several things about California's Mental Health Services Act. You can say, number one, that it is a miracle and a gift from the people. Number two, you can say, credibly, that it is helping tens of thousands of people reclaim their lives. Number three, you can say that there are remarkable programs and providers throughout every community in our state that are using these resources in effective and life-changing ways. Four, you can say that the Mental Health Services Act actually saved the mental health system. Because during the great, I don't know why we call it the great, because there's nothing great about it, the ungreat recession, we know that there were huge hemorrhaging and huge losses to the core system. And of course, Prop 63 was always intended to build on an insufficient base and increase services, and in some way it has, but there are many frustrations, some of which I've heard here today. That do we build upon existing programs, or do we start new programs? Do we invest more in old models that are good and maybe serve more people but not as intensively? Or do we put the money into helping fewer people but helping people more effectively? All in all, I could not be prouder of the signature piece of work in my life in public service. And I could be prouder of the people both in government and in the nonprofit communities and the consumers themselves who are making this miracle come true for so many people. And yet, all that I just said is barely known by the people of California. All I just said is barely known by the 120 members of the legislature who make the public policy for the state of California. All I've just said is rarely, if ever, spoken about by a governor or his executive branch. All of what I've just said is rarely reported in most of the modern media, however that's defined these days. And that troubles me, and it's troubled me for a long time. Because if we can't translate research-based, evidence-based practice into tangible gains in the public policy arena, we are falling short of building that capacity and helping the number of people who we can't help with existing resources and with our existing systems. I believe in local control. And I know I'm going to be on the panel with Dr. Sharon. I'm so glad that he is here and the director in Los Angeles County, and I think it is terrific. And I know him a little bit, and this is a leader. I believe in local control, and I believe that the counties are in fact the entity that has the expertise, certainly on the side of helping those who are most seriously and persistently mentally ill. And they have the relationships with the providers. And the state of California, as much as I love it, I don't want it running mental health or operating the programs. No, thank you. But there is a middle ground between local control and some of the frustration that I and others feel about the future of the Act. And I'm not a doomsayer by any means. But I think if we aren't smarter and more strategic about this Act, that one, we don't fulfill its original intent and its ultimate potential. And worse than that, we run the risk, it's not next election cycle, not the cycle after that, but at some point, some smart political consultant or some governor or somebody is going to say, you know, $2 billion a year, 1% on $1 million earners, that's a populist, easy target. Let's go to the ballot and shift that money to some other compelling cause that actually has taken its research and used and applied it and reported it to the public in the right ways that this is really working. And God, what a tragedy that would be. So there are two answers, none of which are easy. Number one, this is my old saw, we have to be much more focused on outcome-based reporting. And we made some strides, and in LA County, I actually think has done better than most counties I know of, and have actually done a really good job working with my institute up in Sacramento to produce at least some statewide evaluation on full service partnership. LA County has done its own evaluation, but and the state of California will tell us that, I don't know, got the old computer systems that won't be fixed or integrated until 2022 or 2024, and that we won't have a comprehensive data reporting system in place until well into the next decade. So to you, my dear friends at UCLA and UC Davis, please help us. Please take this project and run with it in a way that prevents us from having to suffer more Little Hoover Commission audit reports and other unnecessary bad press around, well, we know this is a good thing, we know it's a great thing, but where's the evidence that it's a good and a great thing? So that's what. I'll get off my soapbox on that one. But there's another thing that's equally important. I want to talk for a minute about disparities. I want to talk about prevention and early intervention and innovation. Because this is an area, frankly, where I'm not sure that the counties, and I'm not picking on the counties because I think they do a fabulous job, don't necessarily have the long-term expertise or experience in dealing with prevention, early intervention. This was a unique part of the Mental Health Services Act. It's really new, even though the Act itself is not that new. And so what we've done, especially as the state has receded in terms of its leadership, mental health got subsumed into the Department of Department of Healthcare Services, which is really a Medi-Cal agency. I don't blame them. They're having to fend off Trump and, the repeal of Obamacare and implement Obamacare. I mean, they got enough to do. But mental health has been sort of lost. And so the money, $500 million a year, not abyssal, as my grandfather would say, not a little bit. $500 million a year for prevention, early intervention, and innovation is being allocated every year in this state for prevention, early intervention, and it's being distributed to 58 counties with, yes, some oversight from the Oversight and Accountability Commission, but no strategic plan from a state or a societal perspective about how we want to spend that money. Now, I believe the money should continue to go through the counties, by the way, so let me stipulate and be clear. But there must be some publicly understood top 3 strategic imperatives of this pot of money. School, and I have my preferences, but hey, I'm no longer in the legislature. But let's define 3. School-based services, campus-based, higher education-based services, and early psychosis intervention, identification, and intervention. The most promising evidence-based practice I've seen out of both UC Davis and UCLA. And let's set standards, and then say to the counties, pick, choose, report back, collect the data, schedule for reporting back, accumulation of the data. We have to do this. And maybe it's going to be LA County that leads the way again, because I know the good doctor and director over here is already on all this. But from a statewide perspective, you know, I'm a little partial to Sacramento these days, as its mayor. And I know this, that 120 of those people from throughout the state spend 4 days a week, 8 months of the year in the capital city. And the governor lives there. And so we can't just do it out of one county, as significant and as large as that one county is. We need, either through legislation or through the ground up, the county mental health directors or the counties or UCLA or UC Davis, or the OAC, we need to develop 3 strategic investments with $500 million and then hold each other to both investing in those areas and then reporting back in a publicly understood, easy to understand, talk radio, editorial board, CNN, matched with real anecdotes and stories, people who got better as a result of XYZ. We put that together and we're aggressive about telling the story and the narrative. And if we do that, if we combine research, strategic thinking and partnership, and effective advocacy, those people who get elected to these high offices, and I know them because I was once one of them, they will get in line to want to carry the next big bill that allows them to deliver the next Prop 63 or the next big legislative solution to trying to help people in their communities. It's an exciting time. It's a great time. You know, to me the glass is always, you know, more than half full. Sometimes, you know, as I read and follow on what's going on in Washington, I think the glass is about an 1/8 full, but at least there's a little water in there. But this is a great set of issues. I call mental health the unattended issue of our time. Unattended to issue of our time. I still believe it. I still think it hits at the cross-section of all the things we care about and spend a lot of money on the back end trying to fix. Not as effective as we could. And that's the other thing about prevention, early intervention. I'm not sure we're ever going to catch our tail here. The homeless issue is so enormous. I don't say in Sacramento we're curing it. I'm saying we're going to make it much better. I know this investment in Los Angeles County is going to result in it being much better. We're not curing it. The only real answer is prevention, early intervention. Tell that teenager at 14 before they get really sick, and then it's expensive, and And more than expensive, it's inhumane, much harder for them to ever get better and reclaim their lives. Thank you so much for having me. I look forward to our panel in a few minutes. Appreciate it.